gentlewoman from California, Ms. Roybal-Allard, for 5 minutes.
Okay. Mr. Speaker, on behalf of my colleagues in the Congressional Hispanic Caucus, the Congressional Black Caucus, and the Congressional Asian and Pacific American Caucus, I rise to introduce the Health Equity and Accountability Act of 2014. The Congressional Tri-Caucus over the past 10 years has been tireless in its efforts to educate Congress and the country about the disproportionate burden of premature deaths and preventable illnesses existing in our minority communities. Towards that end, the Tri-Caucus developed a national strategy for the elimination of racial and ethnic health disparities. The keystone of this strategy is the Tri-Caucus Health Equity and Accountability Act, first introduced in 2003 and every Congress since. HIA, in many ways, is unique. First, the bill and its introduction rotates each Congress among the three caucuses. This year, as chair of the CHC Health Task Force, I have the distinct honor of carrying on the tradition by introducing the bill for the 113th Congress. Second, and most importantly, HIA outlines the collective institutional knowledge of a diverse group of policymakers, health professionals, and advocacy organizations from throughout the country on what policies are needed to halt, reduce, and eliminate health disparities. At the beginning of each new Congress, the HIA Working Group convenes, and several hundred minority and health advocacy organizations meet on a regular basis to discuss the bill and update it based on new research and recommendations to meet the ever-changing needs of our nation's most vulnerable populations. Also, just as the bill introduction rotates each Congress between members' offices, the leadership of the HIA Working Group rotates among advocacy organizations. In the 113th Congress, this effort was spearheaded by the National Latina Institute for Reproductive Health, whose members I commend for their deep commitment to social justice and for their tireless work on this bill, which included coordinating the input of over 350 health and minority advocacy groups. The HIA is a principled living roadmap that can be used by policymakers and providers alike. For example, the Affordable Care Act contains many groundbreaking policies first introduced in HIA, including expansion of Medicaid eligibility, increased resources for community health centers, and institutionalizing federal efforts to achieve health equity. Nevertheless, while the ACA has made a significant impact on access to quality health care, many inequities and obstacles remain that prevent the elimination of health disparities in our country. That is why the HIA of 2014 provides federal resources and advanced policies to improve health outcomes in all populations, regardless of race, ethnicity, immigration status, age, ability, sex, sexual orientation, gender identity, or English proficiency. The HIA is made up of 10 titles proposing a wide spectrum of health initiatives that address disparities in mental health and specific high-impact minority diseases. The bill also provides guidelines for improving the health outcomes for women, children, and families, and targets resources to communities striving to overcome negative social factors. Finally, the bill includes recommendations to enhance data collection, technology, accountability, and evaluation, increase workforce diversity, and ensure access to culturally and linguistically appropriate care. Mr. Speaker, the members of the Tri-Caucus and members of the HIA Working Group believe no one's health or life expectancy should be determined by the color of their skin or the zip code in which they are born. The Health Equity and Accountability Act of 2014 is a consensus blueprint of the most comprehensive and strategic plans to eliminate health disparities in our country. I urge my colleagues to support the Health Equity and Accountability Act of 2014. I yield back the balance of my time.
The gentlelady yields back.